Yeah. Well, let me clip this out. Okay, thanks, Bob. So good evening and welcome to everybody to our community panel on seniors. So I did just want to introduce everyone to our guest speaker for the evening, who is Marrianne McBride, and she's the CEO of the Council on Aging. And thank you for being here, Marrianne.
Absolutely.
When I first volunteered to find a speaker on this topic, I Googled senior services in Sonoma County, and the Council on Aging came up first. So as I was perusing their fantastic website, I was so very impressed with the wide range and depth of services offered to seniors. So tonight, we look forward to hearing about the Council's mission and services, but also more importantly, where we as a church can support the needs of seniors in our community. So I think, as everyone knows, Bob Cheel is our moderator. We can either, put questions in the chat box during the presentation, or we'll follow with a Q&A, and you can raise your hand, then Bob would call on you. So I think that's pretty straightforward. So if any questions, we can get started. So yeah.
Good.
Okay, we're ready to go.
Wonderful. I will go ahead and take it away. First of all, I want to thank you so much for your interest in learning more about seniors here in Sonoma County and how in particular you might be able to help. Certainly appreciate that. So Council on Aging is the premier senior service organization in Sonoma County. We've been serving this community since 1966. So we've been around for a while. We were founded in direct response to the passage of the Older Americans Act, which passed in 1965. And along with the Older Americans Act, there was a provision for funding. And basically, the Older American Act says that as communities, we have a basic responsibility to take care of our seniors. And the funding that went along with it was to ensure that happened. So funding starts at the federal level, goes to a state level, goes to counties throughout the United States. And county government has the option of either providing the services themselves, and some are provided from the county, and of contracting with nonprofits to provide the other services, which is the reason so many senior service organizations popped up. It's far less expensive for a nonprofit to provide the services than for county government to provide the services. So our mission is to enhance the quality of life for our aging population by providing programs and services that promote well-being and maintain independence. We do that through 14 different programs in four specific departments: social services, financial services, health, and then nutrition. And basically, I can run through all of them, but what I like to say is you don't have to remember any of them, but just remember, if you know of anyone who's dealing with challenges of aging, whether a family member or themselves, that the first call that they would make is to Council on Aging. And if it's not a service that we provide ourselves, then we connect people with great local partners. So all you have to remember is Council on Aging. But in social services, we provide information and referral. We receive 30,000 calls, hits, and visits to our office and hits to our website each and every year. So that's 30,000, quite a bit. A lot of people looking for services. We provide case management. So we go into homes, meet with people, kind of assess the current living situation, what's working, what's not working, put together a care plan, and then connect people with resources. We have an advocate at the Family Justice Center who advocates on behalf of seniors who have been victims of elder abuse. We have adult day programs, 3 in Sonoma County. Adult day programs, think of a respite program for someone who might have a relative with some cognitive impairment. So each of our sites are open for 2 days out of the week. Provides the opportunity for someone with physical or cognitive impairments to go to the program for the day, participate in arts and crafts and gentle exercise. They have live entertainment, a meal together, and while the senior is being cared for, their caregiver has an opportunity to take care of the things that that they need to take care of, maybe grocery shopping or a nap or whatever is needed. We have in the health area, we have 2 mental health programs for seniors who have a mental health diagnosis. But one of the programs is just to identify depression in seniors and to connect them with the resources that might help make life a little bit better. Along with our 2 mental health programs, we put on the Sonoma Wine Country Senior Games. And that's an athletic competition for people who are 50 years and older. We consider it our first health and wellness program. This summer, it starts at the end of, beginning of June. It'll be our 10th year putting on the Sonoma Wine Country Games. We have up to 1,500 participants, and it's anything from table tennis to bocce ball to soccer to field and track, volleyball, pickleball, but yeah, again, about 1,500 people per year who participate. And honestly, it's so wonderful to see people from 50 all the way up to, I think our oldest participant was 97, participate in these events. In addition to that, we're also responsible for the implementation of age-friendly Sonoma County. And that's looking at multiple different sectors, from government to healthcare to nonprofit to individuals to business to faith-based organizations, service organizations, and helping everyone come up with strategies to make Sonoma County the best possible place to grow up and to grow old. And I'll share a little bit more about that towards the end of the presentation. But that's sort of a look at our healthcare programs. In addition, we have financial services or fiduciary services. So this, think in terms of if you have a trust or if you have an estate plan, you typically appoint someone as your executor or your trustee, your power of attorney for health, or your power of attorney for finance. In the event that you don't have someone that you would appoint, so maybe don't have children, maybe friends are your own age and you're concerned that they may not outlive you, or you do have kids and maybe the kids aren't financially responsible, or in many cases we act as fiduciary when maybe one of their children has financially abused them and they've been removed from the picture. But probably the most common reason that we're appointed now is because parents don't want to appoint one child and have cause friction with the other adult children when it comes time to distributing the estate. So we currently have about 70 clients that we're actively working on as their private fiduciary. We're typically, again, as I said, their trustee or their conservator, or their executor, power of attorney, kind of on and on and on. About half of our clients are still alive that we're working on, and they've lost capacity. So they're no longer able to take care of their finances. So we make sure that they're taking care of not only their financial well-being, but also their physical well-being. The other half are people who have already passed away, and now we're distributing their estates as per their wishes. We have about another 160 or 70 what we call clients in the drawer, meaning they've named us, we're not needed yet, and we meet with them annually if they would like. And when the time comes to act, then we will act on their behalf. So again, we can act as trustee, as conservator, power of attorney for health or finance as well. So that's our fiduciary services. Our last is our nutrition services, which is what we're most known for. So we provide the Meals on Wheels program here in Sonoma County. We serve about 2,000 seniors a year, but on a given day, it's usually in the neighborhood of about 1,000. People come on and off the program. One thing you should know is Meals on Wheels is for people who are 60 years and older and who are no longer driving or are recovering either from a surgery or an illness and are not able to get out and get food. So again, we have a lot of short-term people who just might come on the program after a hospital stay. So for our Meals on Wheels program, we have 3 meal choices per day. We have a chicken entree, we have a vegetarian, or the third one is it's a mixed bag, although we have printed menus every single month. So it could be a pork item, could be fish, it could be beef. So 3 choices every day, and that's to ensure that people are receiving a meal that they're going to enjoy every single day. So our Meals on Wheels clients are typically frail, homebound, typically don't have a lot of support. They could have adult children that are working and aren't able to get to them during the day, or who live outside of the area. So we're kind of the eyes and the ears. Not only with their meal, they're getting a daily check-in. At least once a week, we'll find someone on the floor who's fallen and isn't able to get back up. So it really is kind of a life-saving program in many ways, because that daily check-in is there. And if there's any change in condition, that we're able to alert family members that either, maybe a doctor visit is appropriate, but that's something we typically always do. The other thing that we do is we provide pet food for Meals on Wheels recipients who might have a dog or cat. What we discovered was they were sharing their meal with their pet because they weren't able to get out and get pet food. So we started the program several years ago, and for any senior who needs pet food, we deliver that monthly to make sure that they're eating their food and the pet's eating their own food, and they're getting the full nutritional value. Our clients, the one meal that they get, it's an entree. It'll always have a protein. It'll have some sort of a starch, a vegetable. They'll also get milk, piece of fruit, and a roll, typically bread as well. So it's a good sized meal. Most of our clients, I think we've discovered about 70% of them, that one meal is 50% of their daily intake of food. And there's about 18% where that's their entire intake of food every single day is that Meals on Wheels delivery. And they'll, have half for lunch and the other half for dinner. So excuse me, it really is a huge support for them. For many of them, the visit by the driver is the only social contact that they'll have in a given day or even a given week. We have clients who, have not been outside their door in the past 9 months or a year. So again, it helps people remain in their homes for the duration of their lives, which is really the goal for all of them. And so fabulous service. In addition to that, we do produce all of the Meals on Wheels for Marin County. We do not home deliver them. We deliver to 3 partner organizations in Marin County, and they home deliver there. But we have the huge production kitchen, and that's why Marin County purchases meals from us. Also, for seniors who are 60 and older but are still mobile, we have dining sites. We have 10 dining sites throughout the county, and people can go and have lunch with a group there. During COVID, our dining sites were closed down, and so we started a program called Drive Up Pickup. And I think we have 8 or 9 sites throughout the county where people can just, they have to reserve it, but they can drive up and get a 5-day meal pack up. They're frozen and ready to take home and to be reheated. And we have not stopped doing that. What we discovered when we were just doing our dining sites, we were serving on average about 3,000 meals per month in our dining sites. When we transitioned to the drive-up pickup, that jumped to 10,000 meals a month. And so basically what we discovered, where there were many food insecure seniors who were not they still drove, but they were not comfortable walking into a dining site and asking for a free meal. But making an appointment or making a reservation, driving up, rolling down their window and taking 5 meals was a real lifesaver for them. And that program continues to grow, especially with the price of food going where it's going. Gas prices, it's tough times right now. And so there's a lot of things when you're on a fixed income that, you have to continue paying no matter what, and your income's not going up, even though the prices are. So these meals really are so beneficial to so many people. So on average, between our Meals on Wheels, our dining sites, and our drive-up pickup, right now we're providing about 29,000 meals each and every month. So I think it's pretty significant. So what's it like to be a senior here in Sonoma County? There are other services as well, but there are also some gaping holes in services that are really, truly needed. So there are, I think our population in Sonoma County is 478,000. 136,000 are over the age of 60. I can tell you, when I started at Council on Aging in 2005, there were 79,000 seniors in Sonoma County. So that's gone from 79,000 to 136,000. And based on current demographics, what we know is it's going to tap out at about 160,000 seniors in Sonoma County, and it will represent well over 30% of our population. So we are a graying community. It's expensive for our kids to stay here. Cost of living is so high that we're going to continue to see a larger and larger and larger senior population. So what are some of the difficulties of being in Sonoma County as a senior? We've done multiple surveys when we got our age-friendly status here in Sonoma County, also through our Aging Together effort that we do in partnership with the county, and really reached out all over, had focus groups, did online in-person surveys as well, but gathered a lot of information. Council on Aging has, as well as the Department of Aging in Sonoma County. And a lot of things were not a big surprise. Main concerns were transportation. 1 in 4 of us will lose our ability to drive within our lifetime. We don't live in a county where it's really easy to get around if we don't have a car. The buses typically stop at 5 or 6. And even if you could take a bus, it could be a long walk to a bus stop. They don't go everywhere. They're definitely not going to allow us to stay as connected as we typically would want to stay in a more urban setting. So transportation's a huge issue and a huge concern for people, and even for all of our local city governments and even the county as well, because the resources just aren't there to provide the type of transportation that we would all hope to have. The other concern is housing. Knowing that you're able to stay in your house or to stay living independently for the duration of your life, or that you're going to be able to afford the type of housing that you might need. So there's a lot of work being done trying to provide more senior housing, but not just more senior housing, but more intergenerational low-income housing. Studies have shown that anytime a senior is in an intergenerational community, they're typically going to do better than if they're just in a senior community. So the new Burbank housing is going to have a mix of low-income senior apartments and also low-income family apartments as well, to help promote that intergenerational relationship as well. So housing, huge. The other is, are my finances going to last for the duration of my life? Which is a common concern. We're living longer. And there's the possibility that the money could run out. So huge concern for seniors. And I'll talk a little bit more about some of the solutions for that. But just to continue on, the other one that popped up that was more of the surprise. We expected financial security, we expected housing, we expected transportation. But the one that I think surprised us all a little bit was the fear of isolation and being no longer relevant. So the feeling that I've worked my life, I've contributed, I have wisdom, I have knowledge to share, and things have changed so dramatically that it doesn't seem to matter anymore. What I might know, what I might be able to share. This turned up in almost every single focus group that we had. And although there are those of us out there who are extroverts and those who are introverts, there was a huge fear of isolation and of being totally alone without any support. And this was only heightened after the fires, knowing that seniors were the hardest hit. And what if no one knows I'm in my house? What if no one's looking for me? What if my hearing aids are out, I don't hear an emergency, my sense of smell has faded. What if I don't smell anything? I don't drive, I can only walk with a walker. Am I going to get out of my house in an emergency? Is anyone going to even know or care that I'm there? So again, this was more of a surprise than we expected, but it just kind of reiterated why we need an age-friendly community, which leads me in now to age-friendly and what that is. An age-friendly community is dependent not only on government doing everything that they can in their strategic planning, in their general plan of keeping an age-friendly filter. So it's very easy to think that that they're reaching everyone without thinking of everyone. It's very easy to say that something, well, it's we care about the entire lifespan. But unless we're thinking, how are we keeping our seniors connected? How is our planning helping them maintain their financial security? Are our parks encouraging a senior to get out and go walking? Are there benches to sit and rest? Are there portable bathrooms along a walking trail, because an older adult may need more bathroom stops than a younger person. If someone has lost their ability to drive and maybe they're located, close to a store, but they need to walk to a store, and there is a crosswalk with the street light, or not the street lights, but the cross lights. Is that cross light going to be long enough so that if they're walking with a walker or with a cane, or even just a little slow, are they going to make it all the way across before that light turns red? But what local government needs to remember too, that if it's good for an 80-year-old, it's also good for an 8-year-old or a mother who's pushing a stroller and is, holding the hand of a toddler at the other hand, trying to get across a street in time. Cracks in the sidewalk. If you're pushing a stroller, that never works. If you're walking, as we get older, we don't pick up our feet as much as we do, which makes, any crack in the sidewalk is a trip hazard. And for an older adult who falls, it's particularly challenging. Recovery is. So that's kind of what we talk to local government about. When we try to talk to them about transportation, they say too expensive. When we talk to them about housing, what we'll say is, make sure that you've got enough senior housing, make sure that that you have a very lenient policy around accessory dwellings. Because for a senior, if you own your property and you have a little space in the back that maybe you could add a granny unit or a guest cottage, that's something that you could put a caregiver in later on. It's something that you could put a tenant in and help subsidize. It's something that maybe you want to move your family into your house and you want to move into the granny unit so that you have family there to help take care of you. Now, I have to say that all of the cities are totally on board with that one. And it's incredibly easy to get a permit and be able to do that. And with so many of the kind of modular or manufactured type homes, there's a lot of options out there. So that's one of the ways that they are definitely on board with this and definitely see the wisdom in it, especially given the numbers of seniors in our community. But besides government, let's talk a little bit about business. So an older adult is going to be a great customer. We shop online a little bit less. We like to frequent a local business. We like to give them our business. So when we show up, are there signs that are big enough that we can actually read? If we get tired, is there a chair to sit down somewhere? Is there a restroom that we can use there? Because all of those are important things. Is our business senior friendly or age friendly? But there's another way of looking at it too. There are seniors who have either been forced out of the workforce or could still use a little extra money to help subsidize Social Security that's really not keeping pace with inflation. So the other focus for us is letting businesses know the benefit of hiring seniors, even if it's just in a part-time position. With seniors, you get a work ethic that's you just can't compare with the work ethic that a senior brings to a workplace. Beyond that, typically they're going to be on Medicare, which means you don't have to worry about health benefits. That's already taken care of. If you get two seniors, one to work the morning, one to work the afternoon, they're never going to call in sick because it's so important. They didn't drink too much the night before. They're going to show up in the morning, and they have skills, they have wisdom, and they have an incredible work ethic. So part of what we want to do and what we do out there in the workplace is really talk about the benefits of hiring a senior. Helps the senior maintain their financial security, and it's an incredible employee for any business. With service organizations, we've created actually strategies for an age-friendly community for every different sector. So if you are a business, we have, I'm going to run through just a little bit here, kind of the focus areas. One is community connectedness, transportation, housing options, healthy living, so that you have the opportunity to engage in activities that help you stay healthy for as long as possible. Hold on here. Oh, I'm going on the website since I'm not at my desk. Oh, here we go. Lifelong learning. So making sure that seniors have access to training, either to continue working or to continue to stimulate your brain. Our brain for as long as is possible is going to add to our longevity. The other is, the next one is employment and financial security, which we just talked about, and health and community-based social services. So to ensure that we have the right healthcare here in the county for older adults, but also so that healthcare and social services are working together with a really good handoff from healthcare to kind of the community type support. Am I running out of time?
Actually, no, Maryanne. I think what you're saying is kind of a good segue into the question of how can we as a church work toward, I'm just wondering if we've got a number of questions in the chat, if you'd like to address some of those. And I know we're thinking of where are some of the holes out there in service? There's so much being done. Where are the gaps?
Yep. I'm happy to do that. Let me hold on. The eyes are not as good as they used to be. So let me address some of the questions in the chat, and then we can go on to that. So the demographics of the clients, I'm guessing that is you're asking like ethnicity or male, female, or all of it. I think that was Patricia. I don't know. Anyway,
span of the client and the average age of client or member. Do you have membership?
No, our clients typically, we have a few who are in their 60s, but for the most part, we typically tend to see them later 70s, 80s, 90s, 100. We have a broad range. Probably average is probably mid 80s. I would say is a safe average. It is more female than male. I think our clientele is probably 60% female, 40% male. Men, a lot of times when they lose their wife, don't know how to cook, so they might be more self-sufficient in many ways, but definitely that cooking thing is not down. So again, we're going to see more of that. More Caucasian. We have more LGBT clients than we've had in the past, and that's a growing number. Not everyone discloses, but again, growing population here in Sonoma County. We're seeing more and more.
I have a question here about conservator services.
Yes.
Do you internally manage the process with the courts?
Or
do you use an outside service?
We have an attorney set up the conservatorship. We do not set them up. We have to examine whether we can take it on as a conservatorship or whether we can't. So we have to have the capacity, and the clients have to have the financial means. So if there's no financial means and they need to be conserved, the public guardian will do that. And so it's kind of a case-by-case basis. But if the financial security is pretty low, then that's a case for the public guardian, because there's no way to pay for the service, and it's expensive service to be able to provide.
Kim Barnett asked that question. Looked like, Kim, you want to follow up on that?
Yeah, real quick. I'm the one who filled up the box, and I apologize, but so my experience with the public guardian, both here in Sonoma County and in Marin County, is pretty pathetic. Their caseload is extraordinarily long. And when you have a senior that's in crisis and you've got to get them conserved, it is a nightmare. And I was just wondering, what do you guys do to help reduce that nightmare?
We, if it's with the public guardian, there's absolutely nothing we can do. And here's the problem. You're going to see more and more and more and more who are going to get thrown to the public guardian, and it's going to create a total crisis, which will then help us correct. So here's the problem right now is on a conservatorship, there's no payment for a year. Okay, so if you are taking care of someone for a year, you don't get paid. You can accrue fees, and then at the end of the year, you bring the billing to the court, and then they basically cut it in half and say this is what you can get paid. So it's getting to a point now where private fiduciaries are refusing to do them entirely and saying throw it to the public guardian. We're trying to get a handle on, okay, if we know up front we're going to get only half of what our billable time is, how many can we afford to do, And what are the means? I mean, are they going to have the means to pay this reduced bill anyway? You'd think, you could inflate the prices and then they would, you could outsmart the court, but you cannot. So something's going to have to change there so that we can get this work back out into the community and out of the public guardian's hands. But it's going to get worse before it gets better, unfortunately.
Right.
So
Kim's got a couple more questions, but I want to ask, does anybody else have a question they'd like to ask at this moment?
I do see something about if we can help with IHSS.
Yeah.
Might be able to a little bit through our case management. So our case management, we like to put together a plan, work with them over, 3 or 4 month period. And I think that would be something that could fall, IHSS application could definitely fall under that. But yeah, basically we like to meet with the client, put together the care plan, connect them with the resources, check back in a couple weeks later. Is that all working? Can I come see you? What's working, what's not? What we find is people typically just want their questions answered and then please go away. So we actually struggle to provide the level of case management that we really do want to provide. So if someone's willing to really let us help them, yeah, we have the time. Transportation services, there are several volunteer programs in Santa Rosa. It's limited to Catholic Charities is funded for it, but it's a volunteer program. I think the hard part for most seniors is it's not instant. It's like you have to call, they have to try to find a volunteer for you. And so if you're impatient, there's not a lot of instant gratification there. We did do a volunteer program for 2 years, and we had a lot of unhappy people because, they would call every, hour. Do you have a ride yet? Do you have a ride yet? Do you have a ride yet? And you're waiting for volunteers. And so we went, yeah, that's not our core competency. So we kind of moved out of that one. Let's see.
Post?
One of the questions that I asked on that was, is there any part of your intake processes asks about religion, or do you have any idea what religion are prominent?
No, we do not.
You don't ask.
It's, we have a standard intake for all of our clients, and a lot of it's driven by the county and by our funding and what we absolutely have to ask. And some of them are intrusive in other ways, and we let people know you don't have to answer them. So there's a lot of questions. And so no, that has not been one that we've been asked to ask.
I guess this might be obvious, but am I right in assuming that all of the services you provide are free of charge to?
The only ones that are not free of charge are our financial services.
I see. Okay.
Oh, really?
Mm-hmm.
Mm-hmm.
And that's a fee-based program. We couldn't afford to do that program.
What
without
kind of
it.
partnering? What kind of partnering do you have going?
I'm sorry?
Meals on Wheels has a fee, doesn't it?
It is, we have to provide everyone the opportunity to provide a donation if they would like, but it is not a condition of service. So, and that's part of our funding. We have to provide an opportunity with a clear message that your service is not dependent on your ability to pay or not pay. So on average, what we tell them, the gap between what we're funded and what the meal costs is $4. So any donation that they would like to make or any contribution up to $4 is appreciated, but not a condition of service. Our average donation is $1 per meal. So then we fundraise $3 per meal. So we have our Older American Act funding, the dollar donation, and then our fundraising efforts are about $3 a person.
Wonderful.
So times that by 30,000 meals a month, and you get the idea. It's a lot of fundraising.
Marrianne, what type of partnerships do you have on with nonprofits like ourselves? You know, where do you see those, and do you see gaps in service again?
I mean, the biggest gap in service right now that we're discovering is full-time day programs for people with cognitive impairment. We used to get, you know, maybe 3 calls a week from people who had a family member with, you know, early dementia needing some help. And now we're getting up to 12 calls a day. We're getting tears. We're getting, I don't know how I'm going to go on. People who are not able to afford memory care, people who can't, I mean, to have a full-time caregiver in the house, you're looking at a minimum of $20,000 a month for full-time bonded licensed care. If you need to put someone in a memory care facility, you're looking at a minimum of $6,000 a month up to $10,000 a month. So you have people who can't afford to work because they're taking care of someone, can't afford a caregiver, can't afford to place them, and are jeopardizing their own health with the stress of what they're going through. So we are trying to get licensed an additional site that'll specifically be an Alzheimer's Day program that will be 5 days a week, that will be full days. But it's not going to be enough. I mean, we'll be able to maybe have 12 people in the program, but we're getting 12 calls a day. In each of our other programs, they're only 2 days a week. Those are funded through the Older American Act, which means they would be, they're free. The new one that will open will be free 2 days a week, and the other 3 days we're going to do a fee-based program because we're renting the facility full time. So that's one of the biggest issues right now for people out there is services for families who are struggling with a dementia diagnosis, whether it be a day program or a live-in program. Yeah, that's probably the biggest gap right now. And I mean, people will tell you about others, but that's the one that just feels like crisis level.
Goodness. Sam, you had a question.
Just to follow up on that topic, is there any possibility, I'm sure probably there isn't, or you would have taken care of it, to find any money through the broader county mental health programs for memory care?
They don't really consider memory care a behavioral health issue. It's a medical diagnosis, but it's not a mental health issue. It's a physical, unfortunately.
Well, so again, it wouldn't be considered a traditional developmental disability, but in a sense it is.
Yeah, no, there's not. We are getting funding. We have 3-day sites currently, the 2 day a week. For all 3 sites, we're getting, our funding is $75,000 a year. It's $25,000 a site, not very high. So this new site, because it's going to require a higher level of care, we'll have to hire nurses. We'll have to dispense medications. We have to have a special facility with locking, so people can't wander, much higher level of care, but we are going to be receiving $150,000 for that. But that's for the one site. And still, even to run this site, we have to have 3 days of fee-based to be able to afford the running of the site. My dream is someday to build a huge facility and do a capital campaign and have a place where you could have 100 people and you could have your virtual little city and nursing interns and people in every room. But I've done a capital campaign and it takes a couple of years. So the other thing that we can do is continue to advocate with our elected officials and let them know this is a crisis. There needs to be resources here. I've suggested, and I need to continue to suggest, that every single either nursing facility, memory care facility needs through licensing to have a percentage of their beds that are low income beds. We do it with housing. Why don't we do it with nursing facilities as well? So I think we need some legislation that mandates that. They're going to raise the prices on the others. That's understandable. But I've had too many people in our lobby crying, and it's not a pretty thing. My husband died in 2015. He was young, but he had Lewy body dementia. And I can tell you that it brought me to my knees in so many ways to try to juggle the care, the in-home help, and then finally the placement in a memory care facility. So it's I know personally what people are dealing with. We're doing everything that we can to help make that better. Our best partners have been churches on our adult day program. We have one at Church of the Roses. We have another one we tried to move to a church.
We did have you located I believe at our Stony Point campus.
Yes,
I think
that's
all we
right.
did, essentially our singular role was to provide the room, correct?
Yep, absolutely. No, it's very true.
Are you still in need of space on that?
We're renting an actual commercial space now, just because they're getting so hard. We tried to go with another church in Sonoma, and they didn't have the sprinkler system. They didn't have the voice activated alarm system. So they're getting more and more stringent on the requirements, which means an older building won't work anymore. So that's why we're continually being forced to move. But the one area we could always use help is with volunteer, especially in our day programs. We're struggling right now. We'll send staff that are working in our financial department to go work in the day programs for the day, just because you really need the bodies.
Could you talk about your COVID protocols in that type of a situation? How is it? Does a volunteer feel safe? Because you know that they wouldn't want to make someone ill, of course.
Yeah, it's very true. We have our own set of protocols if someone has symptoms or if they've been exposed. We have said anyone who is working with our older adult population and spends more than 15 minutes at a time, they have to be vaccinated and boosted and fully up to date. Here's where we've run into a little bit of a problem is our seniors in the program. It was shut down during COVID. We did it all virtually. Some did fairly well through it. Others, their capacity, further slipped. But we have some who cannot keep a mask on for the life of them, don't understand why they have to keep the mask on, and so they'll pull it off. So we've had volunteers who have not felt comfortable with the clients pulling off their masks. So that's been one issue that we've had. But the clients do better in person than they do with the virtual program. So we've lost some volunteers, and then we have others that have just stayed with us, to the very end. They're still hanging. One of the best partnerships we have is with Becoming Independent. Their participants go out and deliver meals. Becoming Independent has, I think, about 7 or 8 routes that they do every single day. And so their participants get to go out and deliver meals. And we have, those are 7 routes. And 7 routes would typically take 5 volunteers. Most of our volunteers volunteer 1 day per week. So when you have one organization take 1 route every single day, that would be the equivalent of 5 volunteers. So when they do 7, that's the equivalent of 35 volunteers, which is just life-saving. Other organizations such as yourself or even companies have decided to adopt a route once a week. So like maybe, Roseland or Rincon Valley, they want to do one of those routes every single Wednesday. And then within their organization, they make sure it's manned. So if you have 20 people who take turns, they know when their week is that they're going to go out. They could do it, 2 people together could go out and do it. But it's a huge relief for us because we know that somebody's going to show up every day. Like, for instance, Medtronic does it, and they did it as a 6-month trial, and 2 years later, they're still doing it because they love it so much. So that's another huge way to help, is adopting a route. You'd have a magnetic sign that says, that this is sponsored by the church, and that they're actually doing that route. It's pretty rewarding. Absolutely. But I do have something on our website, and you're welcome to look at it, or I'm happy to send you the information as well. But it's under aging, and then it's under Aging Together, and it's a booklet called Age-Friendly Strategies for Faith-Based Communities. And so just want to give you some examples. And working on my iPad at the same time is not working well. But things like, again, you can look through it, but let's say putting together a transportation program where and it could just be within your own community, that you have people on call, or someone would be willing to coordinate if there's someone in your community who needs a ride, or that you all agree that you're each going to go into your own neighborhoods at home, and you're going to walk the block each way, and you're going to identify who are the older adults on that block, and you just want their contact information so that you could check in on them and know that they're okay. You could do, a grocery shopping group that would go out and grocery shop for people. You could explore the idea of people who want to attend your services but don't have access to transportation, and then have someone or a group of people who would go pick them up, bring them to the services, and then bring them back afterwards. But transportation limits a lot of people. And so there's, again, all kinds of things that you could set up. I would encourage intergenerational activities wherever you can do that, because everybody benefits. For instance, an older adult who's connected with younger people will stay healthy longer, but the opposite is true with kids. If kids have relationships with older adults, they're healthier too. So always, always, always promote intergenerational in as many different ways as you can. Again, transportation's big. Some churches have housing on site, and maybe you could make that available to an older adult, or just even promote age-friendly strategies within the community. So if you still have people who are working or who own businesses, we could come share what they could do. So bring in speakers on a regular basis. I mean, we have lots. We have people that could come in and talk just about age-friendly. I'm always available to talk about how to live longer, healthier, how to do that in community. I don't know if you know, but if you're connected to a spiritual community, you'll live 7 years longer. I mean, the information is there. I don't know if you're familiar with the blue zones, but that's another, I see some nodding heads. But in every one of those communities, there's a faith-based component, there's a community component, there is purpose. Doesn't matter how old we are, we need purpose. You could create a telephone program to check in on people. The list goes on and on and on. But I'm happy to send you the document, or check out our website, We're always available to come talk, to come strategize. I mean, maybe it's even putting together, how to be an age-friendly congregation. And maybe you just had 3 or 4 goals.
Yeah. Yeah, it's wonderful. Those are great ideas. And I'm sure that there's huge needs out there. And you're right. The opportunities are endless for us to do good work. There was one brief question. Do you have case managers assist with custodial placements?
We basically, no. In our financial services, we do placements there, but we know some great placement people, and basically we would connect them with that. There's some fabulous people out there who have ins everywhere, and I mean it's their job. There's a little, I think they get a fee from the placement from wherever they place them, but there's some great people doing that work. It's very time consuming. And it's important to get the right placement.
Right. Well, we appreciate your time, and I know it's coming up to the end of that. I just want to give opportunity for one more question. If anybody has anything, question or comment. Actually, I see 2 hands. I'm going to ask Diane first, and then go to Kim.
Okay.
Hold on, Kim.
No worries.
Okay. In the volunteer driving, is insurance an issue? When we started the fish food cupboard, it was a multi-service program, and we tried transportation, and insurance for volunteer drivers became an issue for us. So that was stopped.
What we did when we had the volunteer program is we required everyone who was going to be driving someone provide their own insurance and proof of insurance. We had an umbrella policy, but we held everyone to their own insurance. We did not cover it. We did not subsidize it, but we required that everyone had it, and that works just fine.
Yeah, the umbrella policy would be what I was thinking of. So
yeah.
Great, thank you. And Kim.
Kim.
So I just really wanted to talk about advanced directives and pulse. So do your social workers help them or manage the process for getting advanced directives? And are they, because you need to have a license in order to complete a pulse, do you have people available to do that?
No, we used to have a legal department, and we used to do estate planning and all of that. The problem was you can't get an attorney to work for very little money, and so
you don't need an attorney for these.
Yeah, so we're totally out of that, but we'll turn people over to either Santa Rosa Health Clinic or if you want an advanced healthcare directive, Empire Law has a elder law clinic every single week, and they'll do that as well.
Okay, just so for your information, I retired from Kaiser Permanente in 2000.
Yay.
in 2020, and I was the director of case care management and life care planning, palliative care, and
Very cool.
the end of life program. So
My care, my plan. My plan, my care.
That's part
Yes.
of it. Yes.
Yes.
So that was one of the very many hats I held. And so I know, working with both the counties, both Marin and Sonoma, that getting these documents taken care of and into the systems as much as possible. So there are people who are available at Kaiser Permanente that will do it for free for families. So just so you know.
Great.
Wow,
Thank you.
Great to know. Right.
That's
And
really
I could
good
do
to
it too.
Wonderful.
So, that's one of the things I was thinking of starting.
That would be a great thing to do within the congregation, is make sure everybody's got that in order. It's so important.
Yeah, because state lawyers can't do a pulse.
Right, they
because
can't.
they're not licensed. So, it's nice having that license to do that. Okay, thank
Absolutely.
you. I'll shut up now.
Great.
Great. Thank you again, Marianne, for the time you spent. I'm going to turn it back over to Fran at this point, and I'll give you all a thank you so much for what you've done.
Yes.
Yeah.
Yeah, thank you. Thank you so much, Marianne. Very generous offer of you to share your time with us this evening.
Absolutely.
You're giving us a lot to reflect on, and we are going to continue this discussion on how
Wonderful.
we can best serve our seniors in the community, and we love having you as a resource, so.
Thank you. I really appreciate your interest, and thank you so much for the opportunity to talk tonight.
Oh, yeah, that's wonderful.
Marrianne, if the best way to volunteer, is it to call up the Council on Aging office, or what's the
Yeah,
best?
Lee Galton is our volunteer coordinator, and any call would be routed to her.
Fantastic.
Great. Thank you.
Great.
Thank you
All
so
right.
much.
Thanks.
Okay.
You
Maryanne.
too.
Have a good
Bye-bye.
night.
You too. Bye-bye.